And experts say community involvement is key in responding to the HIV epidemic through various programs and local projects. And civil society as well. Community-based organizations have been at the forefront of the fight against HIV/AIDS. Joining us in the studio to discuss this element is Reuben Mubiruis, Program Manager of the Kyetume Community-Based Healthcare CBHC Programme in Uganda. And Daniel Mwisunji is Program Manager with the Regional AIDS Training Network based in Nairobi, Kenya. Gentlemen, welcome to the program.
Thank you.
Reuben, let me start with you. The Kyetume program in Uganda helps the local community with various health services, including HIV/AIDS prevention and care. Tell us about what you do.
Yeah, Kyetume Community-Based Healthcare Program implements an integrated healthcare model of service delivery. And while doing this, we have found out on the way back when we started in 1994, HIV/AIDS became a prominent problem in the community, and we had to get to the mantle to ensure that we could fight it to the end. And as of now, as I talk, we are caring for over 2,600 people who are already enlisted on the palliative care, whereas we have also enrolled 575 people who are eligible for ART treatment, antiretroviral treatment, and we are monitoring them, and they are progressing well on the drug.
Now, it seems like a good number of people, there are 2,000 people and more in the community. Yeah. Who are those that are providing these services? Are there healthcare workers and volunteers?
We have a cross-section of staff, because HIV is both psychological and health-related, physical. So we need to ensure that we have those experts who can conduct counseling. We have the counselors, we have the laboratory technicians who are drawing blood and examining it. We have the medical doctors who carry out the clinical services, and we have the nurses who can conduct the nursing and the care services to the patients.
Okay, and Daniela, let me come to you now. As we understand the importance of community involvement in the fight against HIV/AIDS, there is also an important factor, which is those who deliver those services need to be well trained and understand this disease so they can properly treat and help those that are suffering from it. Tell us about capacity building, how this is done through your organization.
Now, the Regional AIDS Training Network is a membership institution, and we have 35 at the moment, member institutions in 11 countries in Eastern and Southern Africa. And all these institutions have capacity building as one of their key strategies to address the gaps that exist in terms of delivering effective prevention, treatment, and care programs for HIV and AIDS-related programs.
Now, where do you see the most pressing needs as you work with people on the ground? What do you see that needs to be scaled up or where they need more training?
Now, the cuts varies from technical skills for health workers to when you're talking about scaling up male circumcision, you're talking skills. When you're talking about people living with HIV accessing medication, you're talking about the relevant knowledge and skills to be able to dispense. And when you come to Africa, most of the communities, you will not find a doctor. The person you find there is a health worker or a nurse. And therefore, you need to be able to build those skills of such individuals so that the prevention programs can be effective. And when you're talking about community empowerment, you're talking about building the capacities of those institutions, civil society, NGOs that are working at the grassroots to effectively deliver prevention programs.
And Reuben, what can you tell us in terms of the successes of the Kyetume program? What have you seen?
Yeah, from the time we started, we have seen a lot of progress in place. We have seen many initiatives taking place within Kyetume itself, but to be more specific is that we have been able to mobilize community to create awareness on the scourge of HIV/AIDS in 3 sub-counties of Nakisunga, Ntenjeru, and Koja. So in these sub-counties, they make up a whole constituency of Mukono South, which is represented by 1 MP. So by doing this, you find that many people in the beginning, our target was Mukono South, but people are coming outside Mukono South to come for the services. And we have seen many people really coming out to disclose their HIV status. And this encourages us to see to it that we are actually going in for the disease. And currently, as I talk, I see people who were originally bedridden have come back to life and have gone back to their production areas. Some have gone back to their employment positions. Others have continued to support even those who were very sick and died sometime before we got the advanced kind of science in terms of treatment as far as HIV is concerned. And
Daniel, let me have, I will let you have the final word. Tell us about RAT and how it has helped concretely on the ground in the eastern and southern region.
Now, as RATN, we've been able to support institutions to deliver training to over 5,000 health workers in Eastern and Southern Africa so far. We've built capacities of institutions, NGOs especially, local NGOs across Eastern and Southern Africa. We've been able to advocate for capacity building to be brought to the fore, because many times we talk about effective delivery of programs, but we forget that one of the key pillars to ensure that capacity building, those programs are successful, is capacity building.
Absolutely. Unfortunately, that's all the time we have. Gentlemen, Reuben and Daniel, thank you so much for coming today.
Thank you for having us.
And our thanks to Reuben Mubiruis, Program Manager of the Kyetume Community-Based Healthcare Program in Uganda, and Daniel Mwisunji with RATN based in Nairobi, Kenya. And that's our Africa Health Network report for today. For more information, well, check on our website at africahealthnetwork.com.